Now, facial palsy affects more than 100,000 people in the UK, but little is known about it. The condition causes partial freezing of the muscles on one side of the face. It can be triggered by a viral infection. Well, the charity Facial Palsy UK has now launched a campaign to raise money for more research into the condition. Alison Sweeting is from the charity and has also suffered from facial palsy and joins us now. Good morning. Thank you for coming in this morning.
Thank you.
Just start off then. What is facial palsy?
Facial palsy affects the facial nerve, which runs from the top of your face right down to the bottom. So it controls blinking, moving of eyebrows, smiling, breathing as well. So many of the facial functions that we take for granted. And facial palsy basically is where there's the facial nerve can be severed or damaged in some way that means that it doesn't do its job anymore. It can be caused by a number of reasons. Bell's palsy is one that many people have heard of. People can have facial palsy when they're born. It's congenital, there's no known reason for it. It can be caused by trauma, such as a car accident where the face is crushed. In my case, I had surgery to remove a cancerous tumour and the facial nerve was cut during surgery. So many reasons for it. Viral infections can be another cause.
For people who it might come on quite suddenly, you know, I imagine it's something that's very difficult for them to deal with. In any case, it's very difficult to deal with.
It is, and Bell's palsy does come on very suddenly, so somebody can go to bed at night, waking up in the morning, and all of a sudden their face isn't working properly, and their mouth can be twisted to the side, and speaking is very difficult, eating is very difficult, blinking is very difficult. And so there's dealing with those effects of it, but also the psychological impact is absolutely immense. People who've been born with it and have never known any different, there's still a massive psychological impact as well as the functional impact.
And how will more research help those who are suffering?
Because the research is intended to find out more about the causes of facial palsy and also ways in which it can be treated. And there are treatments available, but many GPs and other medical professional staff don't know about them. So the research will help us identify more about the causes of facial palsy, and that will then lead to more treatments being available.
Yeah. You mentioned just before we were chatting, just before off camera, that people with Bell's palsy can make quite a quick recovery if it's caught in time, but often that isn't the case.
You're absolutely right. Bell's palsy, if patients receive steroids within the first 72 hours of the onset of Bell's palsy, they can have a very good chance of a full or almost full recovery. Not for every patient, but for many of them. But of course, if they present to accident and emergency and the medical staff there don't know that this is Bell's palsy and don't know about giving steroids, then the chance is lost.
Yeah, and are there anything symptoms that people can look out for, or is it in some cases just sudden?
It's so sudden that very often there are no symptoms, and I believe Pierce Brosnan, the actor, he was actually doing a live television interview, and Bell's palsy started in his face, so his face started to droop, and then after the interview it got worse, and he was referred for medical help. But there are other causes of facial palsy where people can feel sort of fizzing at their eyes and other symptoms. Sometimes it just, you wake up for an operation and you have it. Yeah.
And why is it, do you think, that it's an area which has lacked funding and lacked research specifically?
Well, I think not much is known about it, and I think it is seen very much as a cosmetic condition. You know, your face looks a little bit different, there's no big problem there. But in fact, it affects the functionality, it affects people blinking. So people who are unable to blink because of facial palsy often have to tape their eyes closed at night. Your eye is either over dry or it over waters, so climate is very difficult. Going to different countries, going into air conditioning can be very hard. If your mouth doesn't work properly, eating can be very hard. Some people have to be restricted to a softer food diet because chewing is difficult. And often we will dribble when having a drink, so you have to choose the right receptacle to drink out of. Often you'll have to use a straw. They're physical and functional, but the emotional impact is immense. A huge number of people with facial palsy have anxiety or depression as a result of it, because we live in a very visible society and people judge us on what we look like. And you know, we have patients with facial palsy who won't go to family weddings because they don't want the photo taken, because they can't smile. Right. And you think of the number of times we say, oh, smile, it might never happen. Well, if you can't smile properly, actually that's very difficult for you. So it's not surprising that social events can be it can be full of anxiety for people with facial palsy.
Yeah, that must be hugely difficult for somebody to, you know, certainly if they've not been born with it and it's a condition which has come on during their lifetime, for them to actually deal with the life-changing face and look at what they have. That must be very hard.
It is very hard, and we're very lucky that Facial Palsy UK has set up a number of support groups throughout the UK, and we're growing them all the time, where people can go along and meet other people with facial palsy, whatever the cause, and there are healthcare professionals professionals there who help us. There are specialist services available, such as facial physiotherapy. But being with other people who've got facial palsy, and particularly people who are further down the road, and can talk about what they've done, how they've dealt with the physical impacts, the functional impacts, and psychological impacts, is really, really helpful. So charity's been great for people. That's only the last 2.5 years. If you get people in their 30s and 40s who've had it all their life, they've had nothing until now.
OK, Alison Sweeting, thank you for joining us this morning.
Thank you very much.